incredibly sophisticated production. This is Matthew Holt with the healthcare blog and Health 2.0, and I'm here with one of my oldest friends. In fact, the guy who told me to start Health 2.0, so he's to blame for a lot. Daniel Palestrant, and hopefully with this cheapo but joint camera that you can see both of us. So before I let Daniel say anything, I'm going to say a couple of words about his background and kind of ask him to set the record straight. These days, Daniel is the CEO of Par8o, Par8o, as it is. But he's best known because back in 2006, five or six, he started Sermo. And I was in the Sermo office when there was a net in the ceiling with a ping pong ball in that net for every single doctor signed up, and it became pretty quickly the biggest social network for doctors ever. It was kind of in some ways the MySpace or the Facebook of doctors back then. So here's what I think happened, and then you'll tell me what's right or wrong. Daniel, you started Sermo. It was a venue where doctors shared a lot of clinical information. If you remember, at the very first Health 2.0 conference, you showed a fantastic thing with the saw blade through the guy's hand.
The straw and the saw blade. How to remove it. In case you ever needed to know how to remove a saw blade.
In case you shovel through your hand and want to get it out, you don't have to remove it.
To this day, I still don't own a buzzsaw because of that image.
Right. And you ended up with raising about $40-odd million, something like that, and having maybe 120-odd thousand doctors signed up on the program. By the time you were there, this is your period, not what Sermo has gone on to great strength since then. But at that point, you did a couple of things. 2 or 3 things happened. By 2009, 2010, you were appearing on CNN and CNBC arguing with Howard Dean and people representing the doctors of Sermo. And Sermo had become quite well known for a place where doctors who were not personally identified out of Facebook, or more like MySpace, could have aliases. We're arguing about politics, and obviously a very contentious time for politics. Secondly, sort of behind the scenes, your business model, which originally started out selling information and sort of polling doctors, as it were, to financial companies, changed and became selling basically drug company marketing, sort of fair way of saying it. And then somewhere by the end of 2011, the money had gone. The rumor I heard was that there was a decent amount of debt left over. You left the company, and there was a recapitalization, and the folks at World One, a market research company, came in, took it over. They raised a bunch more money, and in fact, we've had World One and Peter Kirk and those folks at Health 2.0 several times since then, and Sermo has now got a couple 100,000 people. Actually, it's growing internationally and it's doing
270,000 physicians, and as I understand it, it is the largest healthcare professional community in the world.
Right. So, first question. Is my assessment about correct?
Well, Matthew, as you know, we're here in San Francisco this week presenting healthcare's operating system. And if you think about that, it's a bold statement. This is the largest, most complex, most sophisticated industry perhaps ever. And it's a big idea, and it's an idea that, as you point out, came along in the early days of Sermo. And it was one that even at the time when we realized from the ACA debate how big of an idea it was an idea that we would need time to be able to develop. You can't just stand up at the top of the hill and say, we're healthcare's operating system, although that's exactly what we're doing now. Given that this is an industry that really needs data, we wanted to make sure that you could prove it. So it has been a careful and meticulous process of developing the science behind this technology. But let me take you back to a couple of those years to Sermo and where this all came from, because it's been an incredible journey. As you said, Sermo was both a pioneer in the sense it was the largest and the original physician community, preceded Facebook by a couple of years. It actually came out right as Friendster was sort of crashing and burning, and MySpace was really taking off. And so it really was a pioneer in the sense of an online community. It was also a pioneer in the sense of the business models that it could develop. And so as you point out, the original business model and where we were very, very successful was in what we called information arbitrage, that we could do 2 things. We could survey large numbers of physicians very quickly and very effectively, but then what we could also do is take the insights that this community was doing, anonymize it, and shape it, and then be able to use this to first and foremost advance medical care, but then also it had valuable insights for people in the industry, whether it was the payers, the pharmas, or as you recall, we had a strategic partnership with Bloomberg.
Right.
It was very, very successful. It was a highly profitable undertaking, and it was one that we were very, very proud of because it allowed this physician community to grow and to sustain. One of the things, though, that was really interesting about CIRMA was that we really, in many ways with you, Matthew, we pioneered social media. We had to create a way for an industry that was very regulated, the pharmaceutical industry, to start using social media and to these things that we now all kind of take for granted, that pharma brands will have Facebook pages, and pharma brands will be able to interact directly with consumers and providers. Those were all things that were very pioneering. And in fact, as you'll recall, we used your conference to announce the very first social media pharmaceutical relationship. It was the pioneering relationship between Pfizer and CIRMA. And through that relationship, we actually started developing several of the social media blueprints about how would you do social media in such a regulated environment. And as I understand it, the social media guidelines that I wrote with the team at Pfizer remain in place. And in fact, I was delighted to hear that a number of large pharmaceutical companies are still using the social media guidelines that I developed. As those new guidelines became more generally accepted, to the point that you're making before, the business model was able to expand. And we were seeing more and more different areas of where you could now have interaction between physicians and pharma. And it was an exciting time because pretty much every single pharmaceutical and biologics company was using the CIRMA platform. When the ACA debate took off, what was interesting about it was that CIRMA really, as you point out, was recognized as a voice of physicians. It was the largest physician community in the world. It was far larger than any other physician organization, including the American Medical Association.
Who are not your friends by the end of this, by the way, but we'll talk about that later, right?
But we found that this was a voice that wanted to speak, and it was one that during the ACA debate a lot of people wanted to hear. And it was an incredible opportunity to take social media and really take it to this next level. And as you pointed out, as the ACA debate played out, CIRMA really did take center stage, whether it was through CNN or CNBC or doing these large, highly statistically relevant surveys, 10, 15, 30,000 physicians a week posting on what physicians were saying. And we really got a front row seat to the ACA. In fact, I'll go on record as saying I might be one of the few, if not the only physicians, much less people, that actually read this entire bill.
All 22,000 words or
how
many pages there
are?
There
was 2,107 pages in the copy that I read, and I still have my marked up copy. The point is, it gave us a really interesting insight to the ACA and where the ACA was going to go. And so, we're reading this, we're seeing these survey results, we're hearing the politics, and what was fascinating to all of us was that here you had this bill, and you had the largest physician community, and the physicians were saying things consistently, like insights about what needed to happen in this bill. And when these results would get presented, nobody cared what the physician said. All anybody really cared about was, could they get it to fit their ideological position? And so as the ACA played out, we realized that there was going to be a really interesting opportunity based on what we were seeing as some how the bill was structured, or I should say misstructured, and that was really where the germ of the idea came in. And that germ of an idea really started to grow to the founding team at CIRMA. There's a whole group of people that was like, wow, look at this insight that we're getting. Right around then, one of our largest customers, Johnson & Johnson, approached me and said, clearly you're an innovator in this space. We'd like to have a blue sky discussion with you and our senior leadership. And in that senior leadership meeting, we, on a whiteboard, described how we thought that the key opportunity in healthcare was going to be this need to match more and more people coming into the healthcare system with what you might call a fixed to shrinking supply of resources, or relative resources.
So in primary care anyway, for sure.
On all different levels.
Yep.
And we started talking about the need to what economists describe as Pareto optimization. Creating efficiency through matching supply and demand was going to be one of the key opportunities of healthcare. And Johnson & Johnson actually gave us a $2.5 million grant to develop this and to prove this concept. And over about a year and a half, a team of people at CIRMA started developing both the technology and then what you might call the financial and the intellectual underpinnings of how you could Pareto optimize in healthcare, or simply put, better match the right patient to the right resource at the right time. And the initial feedback was really exciting. Very, very interesting research. We did a lot of ethnographic research, a lot of time in the doctor's offices. And then, out of nowhere, we started getting a lot of interest for a potential acquisition. Not just from one suitor, actually, but from several
So this
suitors.
is for Sermo or for the Par8o?
Sermo.
Okay, and how was Sermo doing financially at that point? Because the word was that the VC had been spent and the revenue wasn't as good as it might have been. Or
Sermo's revenue continued to accelerate upwards. So I'm not sure where our perception about VC money was coming from, but our quarterly numbers were getting higher and higher, and the business model was proving to be more and more successful. So as a point of fact, when the acquisition offers started coming in, there was multiple parties that were interested in the asset on multiple different levels, but it was also an opportunity to take this asset that myself and this team of people at Sermo had been working on and spin it off.
The Par8o part.
The Par8o.
Okay,
It wasn't called Par8o at the
Okay.
time, but it was this sort of concept that Johnson & Johnson had funded. And so when the acquisition took place, when World One acquired Sermo, one of the things that we were able to do was to take the technology and the team and keep them intact and spin it off as a separate company.
So it was around that point you left World One. There was
So it was myself and a team of about 6 people. So one of the conditions that myself and the team had was we were very excited that World One wanted to acquire it. As I said, they were one of many. But one of the things that was very important to me as an entrepreneur was that this thing that we'd been working on, and the team of people that wanted to work, that had been working on it, wanted to continue working on it. So we took the entire group of people and the technology and the IP, and that was spun off as a separate company.
Okay. So before we get into the guts of sort of what happened next, at that time, did you, so World One took over Sermo. They recapitalized, put some more money in. Obviously, they've expanded since then a lot there and more in market research, not so much in the sort of healthcare operating system stuff that you were talking about. How did you and the original management team and the original VCs do out of that? Is there still a piece there? Was this, would that be regarded as a success for you? Were VCs then happy with you?
It was an incredible outcome for everyone. I mean, as I said, we took this thing from nothing. No one had ever heard of an online community to a brand, as you point out, is now a global brand, has 270,000 physicians, and is thought to be the largest online physician community or healthcare professional community in the world. As best as I understand, the outcome was excellent for everyone.
Okay.
And it was a very, very exciting acquisition because it allowed the Sermo brand and the Sermo community to continue to flourish as it had, and then this team of people who'd been working on Par8o to be able to spin it off as a separate entity.
Okay, so around that point, we started seeing a decent number of photos of you online with a cutout of Alfred Par8o in Boston, and I'm not sure if the world thought either that you'd lost your mind or that something secret was coming up, but compared to Sermo, where I got to remember airships being sucked into the vents of exhibit halls and almost dancing girls signing up doctors and incredible publicity around growth, you certainly basically went very quiet, and honestly we didn't really hear from you for really a couple of years. So tell us 2 things. What did you learn and why did you do it that way? And secondly, what were you doing in those couple of years?
Yeah, I think that entrepreneurs then, and I think even more so today, are faced with a challenge, a decision or a dilemma, if you will, of do you want to build value or do you want to build valuation? And by that I mean value is to say, can you create a valuable enough service or technology that clients will pay you for? So
Right.
Can you do something that people will pay you for and build a business, as you have here? Because I'm here at Health 2.0 Global Headquarters, and you...
Not quite as glamorous as the old Sermo headquarters. There was no $45 million in venture capital here. I can pan the room if you like.
But there's something to be said for building a technology and then having that validated by the fact that people will pay for it, or a service that people will pay for. Versus...
And I think that's something that was questioned back in go back to 2006, 7, 8, 9, 10. People were coming at you and me and many other people about
saying,
that.
here's money and you can just build a valuation. And myself and the team at this new entity were very, very determined to not have to make that decision. And we made a commitment to ourselves that we didn't want to go raise large amounts of money until we could find a client that would pay us for what we were doing. And it was a pledge that this team made to one another. It was a small group of people who were very passionate. And to be honest, personally as an entrepreneur, it was also an opportunity to get back to basics. It was sort of like our our Bon Jovi, unplugged moment. We really wanted to get back to sort of a room basically the size of this, where it was 4 or 5 people working. We had 3 dogs, and for a year and a half, we worked on this technology. We worked very hard on actually bridging the gap between theory and practice and making the gears mesh, if you will. And one day, something happened. A phone rang. And it was kind of weird because we didn't even realize we had a landline. And on the other end of the phone was, of all things, a casino. In this case, it happened to be the largest casino in the world, largest employer in the state of Nevada, MGM Resorts. And MGM Resorts described to us a challenge that they had, that they were trying to create a high-performance healthcare network for their 35,000 employees, and they wanted to do this across a network of patient-centered medical homes, 33 PCMHs and 31 different EMRs, and they needed a technology that would essentially act as the operating system across all these different locations. And lo and behold, they were describing the technology that we had just built for them. MGM became Par8o's very first customer and solved or met that initial requirement that we had.
Of paying you money?
Of actually paying us money,
Right.
and they actually paid us to go launch this thing with them. 2 years later, they continue to be our customer. In fact, later this month, we'll be launching now an extension of a metropolitan network out in Las Vegas with a network of 800 physicians that are using Par8o and that same MGM network to stand up an exchange offering on the Nevada Public Exchange. So as the momentum continued to build, we so too took on additional clients. We took on a very large Boston-based Harvard-affiliated academic medical center who also wanted to use our technology in their patient-centered medical home. We've had a number of different hospitals and hospital systems, and with that, we too got more confidence to raise money and start talking about what we're doing. So we were able to prove that we could build value, do something that clients would pay us, and we've built a company that now has a very clear business model. And while we chose to turn down many, many different offers to fund the company, we've hit a threshold where we're confident enough that we've accepted funding.
Okay, so before we talk about the actual news that just came out at the end of last week, and we'll probably end with that, absolutely sort of simply, what does it do?
So a healthcare operating system matches the right patient to the right resource at the right time.
But if I'm a doctor or I'm a physician's office or I'm a patient, what does Par8o bring me that did not exist before?
So right now, if you're in your doctor's office, and let's say you have some sort of a next step in your care, usually what the doctor is going to do is say something or write something down on a piece of paper. In the environments that Par8o's in, so metropolitan Las Vegas, we're about to have our largest rollout with a regional health system in the tri-state area. What happens in all of those environments is that the healthcare operating system kicks in. Depending on what kind of EMR setting they're in, it'll either occur directly within their electronic medical record, or if you might think about like a Dropbox type scenario, where you're a Dropbox or a Box type person.
Both, actually.
Okay.
My pains.
So
and Google Drive, but go on.
So when you're on Dropbox or Box, they're fully integrated into the operating
Right.
system. So it doesn't matter whether you're in your Mac Finder or you're in Word or whatever application, you're able to interact with the cloud. And that's what Par8o does for each of those electronic medical records. It creates a seamless moment where we're able to pull information out and make sure that there's a seamless flow of information. But we do something else that's very interesting. At that moment when that event is occurring, we're creating a place where the 3 key constituents of healthcare can come together: the payers, the patients, and the providers. So we look at the type of plan design that that patient is in, what the clinical next step for that patient is, and we Par8o optimize that step. So is this a transparency-based solution? So are you someone who needs an MRI and you're in a high deductible plan, so you're going to have one set of experience, versus a patient who's in an ACO or narrow network, they're going to need to have a very different set of experiences. And the Par8o operating system, the healthcare's operating system, what it does is it makes that process happen smoothly.
So that essentially means that you are selecting and improving on the referral process, which, as we know, for many, many years has been basically non-existent or broken in terms of following up. So you're, for an MGM or something like that, you are, wherever you are in the system, suggesting the right next steps, referrals, tools, whatever, and then tracking it later and seeing what happened next. Is that correct?
Yeah, you bring up referrals, and referrals are really interesting because referrals occur when there's a change in diagnosis or an escalation in care. Like they're a very high value moment.
And they also go between EMRs.
And they go between
between
EMRs
systems, of course, right?
It's like a solar plexus. It's like a shortcut. And so many organizations correctly recognize that it's one of the most high leverage places to apply our technology. That said, we have a large regional health system in Pennsylvania who uses us exclusively from ED out into the community. We have other hospitals that use us for hospital discharge. And then we also have a number of payers who are deploying us actually by a call center model. So the referrals actually act as an on-ramp to our system. But ultimately what you're looking to do is to Pareto optimize, to match the right patient to the right resource at the right time.
Okay, so two last things. We're starting 2015, so you're now a little bit into 3 years into this. Mm-hmm. Okay. How many customers? Give me a scale. And how many employees, people do you have? Give me a scale of customers and either rough revenues or rough number of people in the system or something like that. So how far have you come in those sort of 3 years being quiet?
So, as you know, it's not an industry that's always known for how quickly it moves.
I've heard that somewhere before. I don't know where.
So we've been at this 2 years. We've had to be really, really patient. And what's powerful about Pareto is that it's a technology component that we're very, very excited about, a cloud-based technology that integrates with all these different EMRs. But probably the thing that we've actually developed that's the most unique is change management. So one of the key members of our team is a woman named Eva Texera, who's a woman who was first at HBS and then went to Bain Consulting, and Eva's passion was how do you do change management in healthcare. And what we've discovered is that what our clients need isn't just a platform. What they need is a way to understand how to apply that platform in their environments. We talk a lot about what we call the 3 Ps: people, process, and platform. So what Pareto does is it engages with these organizations and helps them map out their people and their process, and then how it works in our platform. We also joke that there's a 4th and 5th P, which is politics and personalities.
A combination that happen anywhere in healthcare at all.
And our technology works very well in those all 5 of those Ps. And then there's 3 more Ps, which is the people, the patients, the payers, and the providers. So in the outside world, we're bringing in those 3 communities together. So last month, we passed the threshold of 100,000 patient transactions. So that's 100,000 times.
In total, or
over the year?
Okay.
100,000 transactions through our system. I had an interesting moment a couple of weeks ago. We were interviewing a vendor for a consumer mobile app that will be going out later this year. And they brought a team of people to our office in Boston, and they all introduced themselves, and at the end there was one person in the group that hadn't introduced themselves, and I didn't want to be rude, so I was like, so do you want to introduce yourself? And they said, well, I'm not involved in this project, but I want you to know that I recently had an experience at a hospital here, and I noticed Pareto written on some material that I received, and I want you to know that Pareto actually got me in to see a specialist, and it changed my life. And it was an interesting moment because it was a situation where that employee might not have necessarily been matched the right patient, the right resource at the right time. And it hits you. I throw out a number like 100,000. 100,000 is 100,000 mothers, sisters, brothers, friends who are having critical life moments. So we're proud to have largest employer in the state of Nevada, MGM Resorts. As I said, later this month we'll be standing up an ACO, a physician-driven exchange plan called Well Health Quality Care. In Boston, as I said, we have a very large network of hospitals currently on the system. We'll be announcing a regional rollout in New York City with one of the systems there, and a number of for-profit hospital systems in the Pennsylvania area. And we have quite a backlog of announcements that we'll be making this year.
Okay, so we'll hold on that because we'll talk about those in the next episode of this. But the last one, the one you just did make, is you finally did go public about some money. You raised $10.5 million.
Yep. So we've been very, very conscious about being what you might describe frugal, as very important to us that we link the growth of the company to the value that we're creating for our partners and for our clients. So we've been using a lot of secondhand furniture, and we've been very careful on how we've grown the company. And for a long time, we're reluctant to take too much money. And then Early on, this was actually right after we had done the Sermo spinoff. A group of Boston area venture capital firms approached us and said they had a notion about what we were working on and asked us if we would be willing to accept some funding. So about a year and a half ago, we took funding from Founder Collective. This is an investor in Uber, actually in Omada, another healthcare company, PillPack, some really great healthcare properties, and of course Atlas Venture, who's one of the most prestigious healthcare VCs in Boston, if not the entire country. They invested in us in about a year and a half ago in what you might describe as a seed round. The funding that you were talking about that we announced just recently was a slightly larger round that includes strategic investors, some industry insiders. But we actually took funding, a very small amount of funding, about a year and a half ago.
Okay, so your total in so far is?
10 and a half.
Okay, that bundles up into that's the announcement of that round. And are you out? Have you got that still in the bank, or are you out looking for more, or you're being frugal and growing the company by?
We've continued to be very frugal. And, over the last several weeks, as it's become more and more public about what we're doing, but also some of our results, and we do have a lot of actual empiric data about Pareto optimization in healthcare. We've received a number of investor interest and some acquisition offers, and so we're carefully evaluating our next steps. Our main focus for this year is scaling the business into a national footprint. So we likely will do some sort of a funding event before the end of the year.
So I think my comment would be, and I've made this to you off camera before, is that when you start out, we have our 19 different descriptions about what people do, what companies are doing, and what technology is doing. And there's something called physician knowledge exchange, which was where Soma was, right? And it's something that happens not actually in the heart of the moment when there is actually a decision made about a patient.
Yep.
So you were kind of on the outside there, and there's a lot of stuff that goes on, analysis and all the stuff, and there's a lot of very, very valuable work, and don't want to downplay how important that is, because that knowledge exchange is critical. But you've moved to the point where you're right in the heart of the matter, and you're either going to live or die, I think, presumably, on whether you make those decisions, that are really helpful, and as you say, to improve resource use and improve outcomes, and that's, I guess, what we're going to find out over the next little bit.
Yeah, Matthew, you put your finger on it, actually. I mean, this team of people that was working on this asset, what they wanted to do was to get into the clinical workflow. And that was the mission for Pareto, is how do you actually intersect with that clinical workflow. We'll be presenting some data shortly about an application of our technology called Team Care. And what Team Care does is it allows a primary care doctor, the specialist, and the consumer to all interact in real time. And what we found in one rollout of the technology, in the first cohort of patients, they saw a 65% reduction in unnecessary specialist visits with a commensurate increase in satisfaction of both the providers and the patients. If you think about that, that's extraordinary.
Yeah, no, I think there's a lot of opportunity to use this technology, these types of technologies to change healthcare, and as you said, there's that politics and that people thing to come, but for sure it's exciting. It's exciting times, and it's good to have you back on the healthcare blogs. It's been a long time, too long, while you've been hanging out and being quiet, and interesting to see that I hope those of you watching this kind of enjoyed us chatting basically about almost prehistoric times now, but not quite. Only 6, 7, 8 years ago.
I'm just glad we didn't focus on the blimp.
I remember the blimp. Right, I've been talking with Daniel Palestrant. He's the CEO of Pareto, and you'll be hearing more from us shortly. This is Matthew Holt signing out.